So good morning everyone. So in this video, let us tackle about the teratology and hazards to prenatal development. So what is teratology and hazards to prenatal development? So a teratogen is something that can cause birth defects or abnormalities in developing embryo or fetus upon exposure. So the objectives of this lesson is to understand and identify potential hazards and their impacts on prenatal development, including environmental factors, maternal factors, and genetic influences, in order to promote gestation and fetal development. So there is a study on factors that contribute to birth defects, which is called teratology and teratogens. So the first is teratogens. Teratogens are substances that may produce physical or functional defects in the human embryo or fetus after the pregnant woman is exposed to the substance. Exposure to the teratogen affects the fetus or embryo in a variety of ways. So teratogens are substances, agents, or factors that can disrupt the normal development of an embryo or fetus, leading to congenital abnormalities or birth defects. So there are two examples of such substances. The first is alcohol. So alcohol is a clear liquid that has a strong smell that is used in some medicines and other products, and that is the substance in liquors such as beer, wine, or whiskey that can make a person drunk. So this picture is example of an pregnant woman who drink alcohol. So the second is cocaine. Cocaine is a powerful drug that is used in medicine to stop pain or taken illegally for pleasure. So if the pregnant woman is taking a cocaine or a drug, the baby would be result like this. The baby during his pregnancy period had effect. So the second is the teratology. So the teratology is the field that investigates the causes of congenital or birth defects. A teratogen is that which causes birth defects. It comes from the Greek word tera, which means monster. So the teratology is the scientific study of birth defects or abnormalities in developing organisms, particular, particularly during embryonic and fetal development. So this picture is the example of a teratology. So this picture is the child who have defects. So the next is the clusters of hazards to prenatal development. So number one, prescription and non-prescription drugs. So antibiotic is an example of prescription, and prescription drugs are the diet, non-prescription drugs are the diet pills, aspirin, and coffee. So uh, prescription and non-prescription drugs are medications that can only obtain with a written prescription from a licensed healthcare professional, like a doctor or nurse practitioner. These drugs are typically more potent, specialized, or have potential side effects that require careful supervision. So this picture is an example of prescription and non-prescription drugs. Number two, the psychoactive drugs. These include nicotine, caffeine, and illegal drugs, such as this cigarettes, caffeine, marijuana, and cocaine. So, cocaine is exposure during prenatal development is associated with reduced birth weight, length, and head circumference by Hurt et al. In 1999, cited by Centrac in 2002. Impaired motor development and Arndt et al. In 1999, poor attention skills, and Bandstra 2000 cited by Centrac 2002. So cocaine exposure during prenatal development can have detrimental effects on the developing fetus. When a pregnant woman uses cocaine, the drug can cross the placental barrier, affecting the developing baby's central nervous system. So, heavy drinking by pregnant women is results to the so-called fetal alcohol syndrome or FAS, which is a cluster of abnormalities that appears in children of mothers who drink alcohol heavily during pregnancy by Santrac 2002. So heavy drinking during pregnancy poses significant risk to the developing fetus and can result in a condition known as fetal alcohol spectrum disorder or FASD. When a pregnant woman consumes large amounts of alcohol, it can cross the placenta and negatively impact in developing baby's brain and organs. So this picture is the example of a child with a fetal alcohol syndrome. So the next is the fetal and neonatal deaths. So fetal and neonatal deaths are higher among smoking mothers. There are also higher incidences of preterm births and lower birth weights among children with smoking mothers, by Wang et al. In 2000, quoted by Santrac 2002. So fetal death refers to the death of a fetus before birth, typically before the 20th week of pregnancy. Neonatal death, on the other hand, occurs within the first 28 days of life. Both situations can result from a variety of factors, including genetic abnormalities, complications during pregnancy, or issues during childbirth. So this picture is the example of fetal and neonatal deaths, like a mother who smoked. So the result is the baby have a abnormalities. Number three is the environmental hazards. So environmental hazards. These include radiation in job sites and X-rays, environmental pollutants, toxic wastes, and prolonged exposure to heat in saunas and bathtubs. So environmental hazards refer to substances or conditions in the environment that can pose a risk to human health, ecosystems, or property. These hazards can be natural, like earthquakes or floods, or human-made, such as pollution, toxic chemicals, or industrial waste. So this example of environmental hazards, like this is pollution. Next is the radiation. X-rays also can affect the developing embryo and fetus, with the most dangerous time being the first several weeks after conception, when women do not yet know that they are pregnant, by Samtrack 2002. So X-rays are a form of electromagnetic radiation with higher energy and shorter wavelengths than visible light. In medical context, X-rays are commonly used for diagnostic imaging. When directed through the body, X-rays pass through tissues, but denser structures, such as bones, absorb more X-rays and appear as constructed shadows on the images. So, some reasons that may endanger fetus. So, these are the example of some endanger the fetus. So, number four is the maternal factors. Maternal factors is a sexually transmitted disease, syphilis, general herpes, and AIDS, and rubella. So maternal factors refers to various aspects related to the health and well-being of a pregnant woman that can influence the development and outcomes of the pregnancy. These factors encompass a range of elements, including the mother's overall health, nutrition, age, lifestyle, and pre-existing medical conditions. So these are the examples. Next is according to Santra. 2022, rubella, German measles in 1964-65 resulted in three resulted in 30,000 prenatal and neonatal or newborn deaths, and more than 20,000 affected infants were born with malformations, including this, like this picture, children who had physical abnormalities. So rubella, also known as German measles, is a contagious viral infection caused by the rubella virus. It is typically a mild illness, but if a pregnant woman contracts rubella, especially during the early stages of pregnancy, it can pose serious risk to the developing fetus. Next is the syphilis. Syphilis damages organs after they are formed. These damages include eye lesions, which can cause blindness, and skin lesions. When syphilis is present at birth, other problems involving the central nervous system and gastrointestinal tract that can develop. Okay, so syphilis is a sexually transmitted infection, or STI, caused by the bacterium Treponema pallidum. It progresses in stages, each with distinct symptoms and potential complications if left untreated. So, like this is uh, lesions and the skin lesions. So there are three ways that a mother can affect their child. So the first is during gestation across the placenta, during delivery through contact with maternal blood or fluids, and last is the postpartum or after birth through breastfeeding. So studies shows that increased stress during pregnancy leads to premature birth and reduced birth weight. So maternal malnutrition during pregnancy may also result in adequate growth and fetus. So like this. Next is the folic acid. Folic acid is necessary for pregnant mothers. It can reduce the risk of having baby with serious birth defect of the brain and the spinal cord, called the neural tube. So folic acid is a synthetic form of folate, which is a vitamin essential for various bodily functions, including DNA, synthesis, and cell division. So the next is a baby with spinal bifida. The most common neural tube defects is born with a spine that is not closed. So spinal bifida is a congenital condition characterized by the incomplete closure of the spinal column during early fetal development. This results in a gap or opening in the spine through which the spinal cord and its surrounding membranes may protrude. Next is as maternal age increases, the risk for numerical chromosomal abnormalities increase. A baby with Down syndrome rarely are born to mother and under age 30, but risk increases after the mother reaches 80. The risks are also higher before age 18. So this result, baby we have a abnormalities, physical abnormalities. The next is the paternal factors. Paternal factors: a father's exposure to lead radiation, certain pesticides, and phytochemicals may cause abnormalities in sperm that lead to miscarriage, disease such as childhood cancer. Santrac 2002. So paternal factors refers to various influences related to the male parent or father that can impact reproductive outcomes, fetal development, and the health of the offspring. So, in our conclusions, prenatal development is susceptible to a range of common hazards that can adversely impact the health and well-being of the developing fetus. This includes uh, these hazards, including exposure to teratogenic substances, maternal lifestyle choices, and genetic factors. Underscore the importance of prenatal care and awareness. Mitigating this risk through informed healthcare practices is crucial for promoting optimal prenatal development and ensuring a healthy start for the unborn child. So that's all for today. So thank you for listening and watching.